This meeting is being recorded.
Thanks, Abby. So just as another little bit of a sideline, as well as wanting to share good practice, wanted to just say where we're up to for the region for last year. So whilst all those projects were happening, obviously along that time, people were having annual health checks. Last year, in our region, we had 23,000 people, 24,000 people have an annual health check. And obviously we know they might have been of different levels of quality. That's 70% of people with a learning disability who have had an annual health check. Now, our biggest concern at the end of that was that 9,000 people didn't have an annual health check. And we want to make that better this year because it's really important, one, that they happen, but also that they're good quality. And at the end of that quality, that everyone leaves with an action plan. And we know that that hasn't always happened because not only have the numbers shown that the annual health checks might not have all have happened, 70%, that actually only about 60% of people had an action plan to go back with. And I think given the fact that we know we've had COVID, that people have flu jabs, that there's other screening projects that need to happen, that really everybody should leave with an annual health check, an action plan at the end of their annual health check. So some of these pieces of work that you're going to be told about might actually involve talking about what you should be having at the end of your check. So whilst this year, last year and this beginning of this year, we've looked at the projects and the impact that has happened and what changes have happened with quality. We want to increase the numbers. So hopefully this year, by increasing the quality, improving the quality, more people will then want to have an annual health check because they hear how good they are going to become. So maybe this year, coming up throughout this year, that there will be more work that we can see happening and more annual health checks happening. Which will be a really positive impact. And so I ask that if anyone didn't have one last year, that we think about having one and asking your doctor to have one as soon as possible. So, you know, we break it down into lots of different areas. Lots of people have them around after Christmas, but we really want to see if you haven't had one, then it's really important that we come up with other ideas as to how we bring that forward earlier in the year. Now, Crystal, did you say that you've now got sound, or is that still a no?
I'm here. Can you hear me?
Hey, well done, Crystal. Thank you. So before I introduce Crystal, we're just going to show you that the agenda is really tight and everybody's got a bit of a slot. So you'll see all the different people that are going to talk about their work. But first of all, I'm going to hand over to Crystal Hemingway. And Crystal, do you want to introduce yourself? There's no point me doing that. You can do that.
Thanks, Tracy. So I'm Crystal Hemingway and I'm the primary care lead within the Health Improvement Team, which is part of the Learning Disability and Autism Programme at NHS England. I think a couple of my colleagues are on the call, Fazila Meady and Paul James. I think they've introduced themselves in the chat. Oh, we lost Tracy.
Oh no, sorry, I'd taken myself off here. So I just wanted everyone to first of all meet Crystal, to know that this is everybody across the country that we're working, that we want annual health checks to happen, and also for you to see that there's lots of people involved in making this happen that are there to support you. So Crystal, I just wanted to really see if you could just give a little bit of a view from the national team of the importance of annual health checks, if that's okay.
Yeah. Definitely. So, you know, without going over ground that people will probably cover with some of the really great presentations that are taking place today, we know that the annual health check is one of the single most benefits that you can access in order to prevent ongoing and worsening of long-term condition problems. So problems around your heart, problems around your bowels, problems with your lungs. You know, lots of people with a learning disability also have other health conditions, and we want to make sure that people receive the best health care they can for those conditions as well. So the annual health check allows you to have those conversations with your doctor to make sure you're getting the input that you need regarding your other health conditions as well. It supports you to access things like flu injections and obviously ongoing COVID vaccinations, but it also helps around alleviating some anxieties that people might have and worries and concerns in accessing things like cancer screening, you know, so whether that's for ladies with a learning disability, whether that's breast and cervical screening, prostate screening for men, other screening programs such as when people have diabetes, there's risks around that, particularly with regards to eyesight. So we want to use the annual health check to make sure that people are accessing all the other services that are available so that they can stay healthy and well. And ensure that where they need additional support or they might need specialist input with things like epilepsy or you know, things like having problems with the heart, then your doctor is referring you on to those services, and you are getting the input that you require, with a view to keeping people healthy and well as long as possible, and making sure people are living the best lives they can, really.
That's brilliant. Thank you, Crystal. And as I say, there's a lot of people out there to support you, not to mention from the national team, the regional team for NHS England, but also we're going to hear now about all the different pieces of work that's happening across the region, across the different areas. So I think our first presentation, thank you for joining us, Crystal, and hopefully you'll hear about the other work that's going on and be of interest to you. But we're going to start with Essex and Susanna, who's going to talk about a piece of work that they've been doing and share some best practice from there. So Susanna, are you there?
I'm there, I'm here, and also we've got Angie and Rob on the call as well, so you're going to have three voices from Essex.
Oh, right. That's fine. So I'm going to hand over to you and you can talk all about Essex.
Okay, a little bit of practical. Will I be moving the slides? No, looks Claudia's all over it. Okay, there's my slides.
Yes,
it's happened already.
Just let me know next slide and I'll move it for you, no problem.
Oh, thank you very much indeed. And hopefully Angie and Rob, you're ready to come in as well. Just to say, I'm Susanna, so representing Essex, so that's local authority areas of Essex, Southend and Thurrock, and we called our presentation More Than Numbers, because we do have to count a lot of things, including how many annual health checks we do, and also how many leader reviews we do, and I'll come on to that in one sec. But behind the numbers, we're really keen to learn from what we're finding out to make improvements, especially to our health checks. So next slide. Just in case you haven't heard about LEADER before, I'd like to say it's about learning from the lives and deaths of people who have learning disability or autism. When someone sadly dies, we carry out a full review, and that includes looking at GP notes for whether they had their annual health checks and something around the quality of that as well, including whether they had health action plans. And what we're doing, we're learning from these reviews to try and improve health checks, especially around how these can be used to better manage people's conditions. Next slide. So I'm going to hand over to Angie and Rob, who've joined us.
Susan, I can't see your slides.
You can't see my slide? You can't see?
No.
Oh, can everyone not see the slides?
No, Susanna, we can see your slides. Jennifer, we'll send them around at the end, and maybe it's a good time to listen to everybody if that's okay, because I think most people can. I don't know if there's any support. So
yeah, we can send them, everyone will get them, so you can look at them at the end. But Angie and Rob, I think we're just going to have a little chat about the diabetes project that they've been working on. Is that okay?
Hi everybody, hi, I'm Angie and you are?
I'm Robert.
Okay. and we're in Essex, aren't we?
Yeah.
Rob's going to talk to you. Rob and I are going to talk to you about the diabetes health champions. So, Rob, you're diabetes health champion. What does that mean? What do you do?
We talk about people, we talk to people that's got a learning disability, what has got diabetes.
Okay, so we join in a Zoom meeting, don't we? Once a month.
Once a month, yeah.
Yeah. But there's not just people with learning disabilities who are health champions. Do you know who else is health champions on the call?
No.
No? Okay, so other people who are health champions that are on the call are doctors, practice nurses from the GP surgeries.
Yeah.
They might be a parent.
Yeah.
Or they might be an occupational therapist,
yeah,
or a speech therapist. So anybody that has an interest in people with learning disabilities who have diabetes and how to make the services better, isn't it?
Yeah.
And on our Zoom meetings, we learn things as well. So last time we had the dietitian there, didn't we?
Yeah.
Do you remember some of the things she taught us? She did a quiz with us, didn't she?
Which things are good and which things are bad?
Yeah, which things are good and which things are bad, aren't they?
Yeah.
Yeah. And some of them were a bit of a shock to us.
Yeah.
Yeah, because the lady showed us a Kit Kat and she showed us a healthy eating bar, and she said which one would be better for it, or which one was worse for us to eat. Do you remember which one it was? Was
Kit
it
Kat.
No, it was a healthy eating bar. It had more sugar in it, didn't it?
I thought Kit Kat had sugar in it and all.
They do, but it was a measure. It was about which one was worse for us. Yeah.
And also, they were saying get a small banana instead of a big banana.
That was one of the ones that we learned really well, didn't we? So we learned that if you have a big banana,
it's 17 calories.
And if you have a smaller banana, it's
7 calories.
Yeah, so huge difference. Yeah. So that was really good. So when we go to meetings, we talk to lots of people. You tell them a little bit about yourself. Why do you think that's important? Could you tell them about your thing on your arm? What's the thing on your arm?
I forgot what I call that.
It's called Liberator, aren't they?
A liberator.
Yeah, and what happens with them? What have you got to do?
Test your sugar.
You test your sugar every day. Well, lots of times during the day, don't you?
8 times you have to do it.
Yeah, and that helps you to work out whether you need to eat some more carbohydrates.
Yeah.
Or actually maybe have a few drinks and do some exercise, doesn't it?
And drink more water.
And drink more water. Okay. What are the other things that Rob and I have done? We went on a training day, didn't we?
Training day in Chelmsford.
Yeah. What sort of things happened at our training day?
We done sport.
Yeah, we went. The people from Sports for Confidence came, didn't they? What sort of exercises did they do with us?
We done exercises sitting on the chair, and we were doing it to music.
It was fun. I enjoyed doing that as well. What other things did we do on that day?
We see a doctor on Zoom, and she was telling us about her dad used to have diabetes, and he ain't got, he's been took off of the
Off of his insulin. That was a really special talk, wasn't it? It was about her dad.
Because she was saying her dad used to be quite big, but he's lost a lot of weight.
That's right. So that was a very, very special diet, wasn't it? He went on a very special diet to help him.
Yeah.
Oh. And the last thing we did before because Susanna needs to come in again.
Yeah.
The last thing we did on there was we did something with little bits of food, plastic bits of food.
Plastic bits of food.
And what do we do with them?
We picked out which was good and which was bad.
Yeah, we had to put them into categories, didn't we?
Put them into categories.
Yeah. So
Mhm.
that's a very sweeping thing of some of the things that in Essex we're trying to do to improve people with diabetes, the understanding of people with learning disability with diabetes, but also the professionals as well, to ensure that people in GP surgeries understand the needs of people with learning disability. So we're going to hand back over to Sue because Rob's going off to college. So bye,
Thank
everyone.
you. Thank you so much. Thanks for doing that.
Yeah.
That's brilliant. Oh, okay, thank you. Can we have the next slide? So that's a whistle-stop tour of one of the projects. And just very briefly, we've also been looking at heart health because that's something that was flagged in a number of our leader reviews that didn't seem to be getting addressed in our annual health checks. Next slide. So we've actually developing a 5-point plan around heart health. That needs a couple of clicks to get through all of the. It's got a transition thing on it, but we're actually only on stage 1, so I won't be taking you through all of the 5-point thing. Do you want to whiz through that, Claudia? 2, 3, 4, 5. Next slide. We're only on phase 1 really at the moment. So we've got together a group of people to develop how we're going to promote healthy hearts. Next slide. And what we've got together already, we've worked on and developed some new promotional material. We've got posters and social media. We've got plans for how to join a community roadshow. We've got plans for a training program. And I just wanted to show you this before we finish. If you click for the next, we've got 3 slides, Claudia, if you want to go through. I just wanted to show you, we've been working on some better, easy read literature about heart health, steps to a healthy heart, that was going to be made available. And we've got, if you do the next slide for me. As you can see, there's a lot to do. We've started, just like Rob and Angie talked about, we're linking this work in with looking at other things that we want to get addressed through the annual health checks, things around weight management, obesity, diet, referral into exercise, more screening programs so that we don't see so many things like suspected conditions, we see diagnosed conditions. And to maximise the opportunity for discussion and support through those annual health checks. So I think final slide from me. We have a 3-year plan for our health checks, and obviously we want to help people get their health checks. We want them to go in prepared, so we're developing quite a long and supportive questionnaire for people to do in advance of their health check to make sure they get the best out of it. We are investing in training for doctors to get the health action plans that we want to see. We want to follow up to make sure that people are getting the right services. And our focus for this year is going to be very much around what's in that health action plan. Have people been vaccinated? Where people are at with their cancer screenings, for example, and included in that, have people got their health passports? What support do people need to get all of these things? So I've probably gone over my time. So my very, very last slide is just, if people have questions, you can use this. If you've got questions about Leader in the 3-year plan, that's my details. Questions about the diabetes project, I've put Angela's email, Angie, who you met. And if you're interested in finding out a little bit more about heart health and how we want to improve heart outcomes through the annual health checks, there's a chap called Ian. So I've left you all those details if you've got questions or want to be involved in those projects. Thank you very much for your time, and thank you for Angie and Rob for joining me on the call.
Thank you, Susanna. I told you that some of these will be a bit of a whistle-stop tour, and I know we started a bit late. So just wondering, going to give you a moment if anyone's got any questions in the chat. I suppose just the only thing, Susanna, is you've got a really long plan, and 3 years is a long time. What help is there at the moment if someone needs some of those points to be addressed or to be looked at? If someone had a learning disability, would there be a contact details for them as well?
Yeah, so if somebody had a specific thing that they wanted to ask about, or if they had a specific problem, so put that, if that wanted to come through me, that's on that last slide, I'm the top one, Susanna Eady, or I'm also on the email. If you've had the round robin inviting you, you can find my name on the email. You can email me through that.
Yes. So if anyone wants, as I say, any more questions around the different projects specific to improving the health that comes out of the annual health checks, because there are 2 questions that should be asked on the annual health check, but also just wider, how can I get help around my annual health check, then Susanna will be able to give that information, and we'll do a Q&A at the end, which we can send around, so we can do a frequently asked questions. This sounds like some amazing work. That's really positive. And I think very specific work that's come out of the annual health checks is really nice to hear as well. So that's where your quality work's been focused. So thank you, Susanna. You didn't go over time. You pulled it back. So.
Hey!
I'm going to move on now to BLMK, and that's Bedford, Lutes and Milton Keynes. I'm going to introduce you to Daniel. Is Daniel there? Can you unmute Daniel, please?
Hello, everyone.
Hello, Daniel. And Daniel's a bit of a whiz on numbers. So he's going to talk about a quality project that they've been doing in Bedford. And I'm not going to steal your thunder, but if there's anything that you find difficult about numbers, then again, let me know and we can send some more information at the end. But Daniel's able to tell you all about the work that's been happening there. So can I just hand over to Daniel?
Yep. Hello, everyone. My name is Daniel. I'm Learning Disabilities Annual Health Check Project Support Officer. And today I'll be talking to you about an impact story regarding data around annual health checks. Next slide, please, Claudia. Okay, so we wanted to improve the accuracy of data recording and to learn some lessons from what the data tells us. To start off, we looked at health action plans. We found that in 2020, we had 64% of patients that had an annual health check also had a health action plan. This raised to 85% in the 2021-22 financial year. So we saw a massive improvement in the number of health action plans being logged as a part of an annual health check. And this is really important because health action plans help doctors and nurses, clinicians and patients keep track of healthcare that happens after their annual health check. We also found that 52% of patients of all age groups with a learning disability also have other long-term health conditions such as asthma, cardiovascular disease, respiratory diseases, epilepsy, diabetes, obesity, serious mental illness, and others. This figure raised to 57% for people aged 14 and over. What we found interesting was that people who did not have another long-term health condition were less likely to have an annual health check. This is kind of interesting because there may be more people out there who are healthy, but they may have health conditions underneath that could be detected by a blood test or an ECG or something else. So it's really important to sort of raise awareness to everyone that we can when it comes to promoting annual health checks. We also found that 19% of patients aged 14 and over and 17% of patients aged 19 and over have not received an annual health check in the last 5 years. This is interesting because it means that roughly 1 in 5 people are not engaging with the annual health check programme whatsoever. So it means that there's a group of people that are hard to reach when it comes to healthcare. And we need to learn from patients and clients why is it that they're not interested in receiving healthcare, and more importantly to promote the importance of receiving an annual health check so that they can stay healthy. We found that 57% of the learning disability register had received a blood test last year, regardless of whether or not they had an annual health check. Blood tests are very important because they can help us to detect diabetes and cardiovascular disease, high cholesterol, and other important conditions that are beneath the surface that we can't see. Next slide, please, Claudia. Yeah, so the patient groups that were least likely to receive an annual health check are as follows. Children aged 14 to 17 years old, and that also includes children aged 14 to 24 were least likely to have an annual health check. This was important for us to learn because it means that we need to promote annual health checks more amongst families and carers, amongst specialist educational needs teams, and with health visitors who go visit sort of learning disability children in schools. Patients who have languages unknown or unknown ethnicity recordings on doctors' medical records are less likely to have an annual health check. This is interesting to know because communication seems to be really important when it comes to promoting annual health checks to people with a learning disability. Therefore, we need to improve engagement with doctors' surgery, improve engagement between doctors' surgeries and patients to get a better understanding of who the patients are that they're supporting in order to deliver the best possible healthcare to them. We also found that healthy patients without long-term health conditions known to NHS less likely to have an health check. I've explained that. Patients with a mild or moderate learning disability are less likely to receive an annual health check than those with a severe or profound. Now, what we found was when it came to learning disability diagnoses, we found that patients were likely to be diagnosed with a mild or a moderate disability first, and then as doctors and nurses got to learn more about the patients through their healthcare, then these diagnoses would be upscaled to, say, severe or profound disability if necessary. This is actually really good practice from our doctors and nurses because it means that they're taking their time to develop that rapport and relationship with the patient to find out exactly what their needs are before developing more appropriate healthcare to the needs of every individual patient. We also found that patients with an unknown severity of learning disability were the least likely to receive an annual health check. Again, it's going back to this pattern we've identified where patients where we know less information about them on doctors' healthcare records are less likely to receive an annual health check. We also found that patients with an unknown ethnicity or patients from a Black, Asian or minority ethnic group were less likely to have an annual health check. With the unknown ethnicities, again, it's going back to that pattern where we seem to have a small group of patients who aren't receiving much healthcare, not engaging with their doctors as much as we would like them to. And we need to do some more learning from patients and clients to find out what is it that the local authorities and doctors can do to encourage them to actually go in for the healthcare, the free healthcare which they are entitled to and what they need. We also found that patients that have not received a blood pressure reading or body mass index or flu vaccination were less likely to have an annual health check. Again, it seems to be that pattern where there's a small number of people where we don't know why they're not engaging with healthcare, but we need to find out what these reasons are. So next slide, please, Claudia. So how do we counter these problems that we've discovered? So we established a learning disability annual health check steering group, which is a group of people who are commissioners, specialist nurses, primary care leads and doctors and other really important people who are at the forefront of delivering healthcare to people with a learning disability. The steering group acts as a platform in order to share data with regards to learning disability registers and how many annual health checks are being delivered, how many health action plans are being delivered. And it also allows all of these important people to figure out the best strategies in which how to engage with patients with learning disability, how to approach them, and how to provide the best possible support. We are promoting greater awareness of annual health checks to children's services, social care, health visiting teams, families, carers, and special educational needs, to explain what difficulties we found, and to also to gain feedback with regards to how best we can communicate the importance of annual health checks to people with a learning disability. We also have East London Foundation Trust and a few colleagues I've seen here in the call, who are a group of specialist nurses who are involved in various things such as delivering psychological therapy, talking therapy, kind of sensory therapy, in order to help improve, reduce anxieties that patients may have when attending their doctor's surgeries, and also to gain feedback from service users with regards to what works best for them. Where would they like to receive their annual health check, to ensure that the best reasonable adjustments are identified to suit every individual person. Next slide, please, Claudia. I think that's it for me. Oh, that's the last one. Okay, so last slide is we've been developing some geographical mapping for Bedfordshire, Lutes and Milton Keynes, which we haven't finalised just yet. But the mapping, it will, from what we've seen from initial results, is that learning disability prevalence seems to be a lot higher in deprived areas. But when it comes to the uptake of annual health checks, there seems to be little variation in the number of people receiving an annual health check, depending on whether they're living in a deprived or an affluent area. Other developments we're looking into would be the use of point of care. Oh, sorry, someone wants to ask a question? No, okay, I'll carry on then. We're also considering increasing the use of point of care blood testing kits. These are like non-invasive blood testing kits where it's like a really small finger prick. It doesn't really hurt much and it gives results within 5 minutes to a high degree of accuracy. We're looking to improve, we're considering improving the number of these being used within doctor surgeries because it's a more comfortable way of delivering a blood test. And it also gives the option, because they're really small devices that are portable, you can actually deliver these either in a community setting or at home, and it just makes it easier and less stressful for a patient. We are also looking to upgrade our health check promotional material. So NHS England are kindly helping to support us to develop and reach out to other local authorities to develop promotional material in foreign languages, including British Sign Language and Makaton. We are also looking to improve access to translation, interpretation and advocacy services, which means basically sharing more resources and support to help patients to better communicate with healthcare services. And lastly, we're considering greater use of co-production strategies within health sectors. What this means is we're looking to develop more workshops and things where we get patients involved, where we get to hear patient feedback with regards to how best to deliver these annual health checks. Because what's really important is delivering healthcare that's suitable for each individual patient. So we'll be looking to hear a lot more qualitative feedback, which would be improving the quality with regards to what patients say about their experiences and how we can deliver better healthcare to patients based on what those experiences are. Thank you everyone for your time. Does anyone have any questions?
Okay, Daniel, I was going to just go through some stuff on the chat. Who's raised a question?
Yeah, I was just going to say, I'll just put it in the chat about ACE Angular. It'd be good if ACE Angular had an annual health check steering group, because we've got an ACE advocacy steering group that a chap called Chewy runs, and Abby will explain more of that, but I don't know if she's on here or not because I haven't seen all the people on here.
Yeah, I know it's busy. It's really busy. There's 87 people on at the moment. So yeah, I think one of the things, and Daniel, sorry for speaking for you, but one of the things I go to that steering group, and it has been a real transformation to get things moving. I think what it shows from Daniel's point of view is that how much work needed to happen before any of these changes happened. So they couldn't just come up with a project to say, all right, we're going to give lots of people more annual health checks. They needed to know why people weren't having them in the first place. So Daniel's been amazing in being able to find out that things like the ethnicity and people from different cultures and children and young people are really target areas they need to work on. So just pulling through a few of the questions. So just picking up on one from Susanna, I think someone asked about Suffolk and diabetes. And this is why it is really good we're doing today, because where we still aren't seeing things being done, we can take that away and look at that across our region. But Nicola Lawson said that in the Learning Disability Nurses team, although they don't have a special project for diabetes, there is something that you can do through speaking to community learning disability nurses, and she's put her email address in the chat. And I think that's probably going to go for a lot of the nurses. I think the very specific piece of work is about really drilling down, but if anyone needed help around diabetes, I know that community learning disability nurses are your call. Someone mentioned about having blood tests around reasonable adjustments, and obviously reasonable adjustments is so key to making sure people have good access to services. And when we talk about the blood tests, obviously one of the points that Daniel made was looking at alternative ways the test happens with the prick test these days. And also someone else mentioned, I think it might have been the same person, about urine tests. So we want to make sure that if that's something we can look at as another option, that we make sure that people are aware of that, and we can look at all those different options. Some of those tests probably don't pick up on all the tests that the big blood tests might, but I think we need to pull together as much information about that person's health as possible. I don't know if they're a BLMK project, but someone also mentioned in the chat that there is one of the areas is commission. So they've brought in a service to an organisation to specifically work with children and young people to get annual health checks, which sounds amazing. And do email me if there's any information with that. And I get that when someone else said it was a bit worrying that GPs ring out of the blue when you need to book an annual health check. And sometimes maybe if you know you're needing your annual health check, then maybe in order to avoid that happening, that you take the initiative and ring up the GP and say, I think I need an annual health check. And then you're in control of the situation a bit more. So that's really important. And just kind of nipping back to the ethnicity, I know that the national team are doing a lot of work around that and engaging other organisations to help us look at why people from ethnic groups, so Black, Asian, minority groups, aren't having annual health checks. So hopefully that's definitely going to see a change again this year, but also just the work that Daniel's team are doing to look at putting things into other languages will hopefully be a real drive to make those changes. So,
sorry, Claudia, I've actually got my annual health check on Friday.
Wow, that's brilliant. So you can hear all the good things that are happening today and go, if it's not very good, you'll be able to go back and say, no,
she sent me a letter and I went there the day after to book it.
Oh, brilliant, brilliant. So you used the information. Excellent. Okay, thank you very much. We're going to put you back on mute. That's really good to hear that people have got their information, and it's good to hear that it's so early in the year to get it, because we hear it later in the year. So well done. I am going to move on now. Thank you, Daniel. We're going to move on to Steph and Layla from Norfolk and Waveney. And I'm quite conscious we're probably a few minutes behind, but if we speak to Norfolk and Waveney and Steph, what we'll do then is be able to have a little bit of a break after that, because there's a lot of information coming out here. So I'm going to hand over to Steph and Layla. Are you there?
Yes, I'm here.
Yeah,
thank you.
I'll put myself back on mute. Sorry, Layla.
Thank you. Steph?
Yep, over to you.
Thank you. We are from Norfolk and Waveney, CCG, and we are working. We started, next slide, please, Steph. We started last year in March, and I'm going to introduce our team. In the front line, there are Steph Chamberlain, which is she's a health improvement nurse for learning disabilities, Bridget Shad, health improvement nurse for learning disabilities, and myself. I am a health improvement worker for learning disabilities. And we have help from our line manager, Rachel Garwood. She is a senior nurse learning disability quality improvement. And we have two clinical advisors, Dr. Helen Barclay and Sharon Darnam. The next slide, please, Steph. The project started in March 2021. It was meant for only 1 year, but now they extended because of the positive impact that it has on Norwich 1. They extended it another year. And our aim was to improve annual health check and to increase it among people with learning disabilities. And that wasn't the only thing that to increase it, but we wanted as well to improve the quality of annual health checks and to support people who have experience when they are at their GP surgery, to have a good experience, and that will help them to think about going back for it the year after. And we had a focus on engaging with people from ethnic minorities. And to the team, we are working with people with learning from ethnic minorities and the most socially excluded communities in Norfolk and Waveney to promote and educate people about annual health check and to help reduce health inequality among these communities. And to identify people with learning disabilities from these communities, we have networked with charities, voluntary and statutory providers, and community groups. And we have used many methods, including virtual meetings, letters, visits, and telephone calls. We have contact with the travel sites, and we are hoping to have more in the future. We have attended Black History Month launch event held in the forum. And we had stall to promote annual health check and awareness among these communities. And we're hoping to join another one happening in June. We have gave presentation to YMCA staff and residents about annual health check, attended Mosque Food Bank, where so many people come there to pick up the food, especially people, homeless people, to talk to them and to educate them about annual health check. We met with religious leaders and provided them with information and easy read booklets to give to the community, linked up with the team running the vaccination bus, attended the equality and diversity meetings which happen once a month. We attend that one to talk about so many things. And we started working with GP surgeries in the area of Norwich, and now we are going to South Norfolk. Next slide, please, Steph. And how everything work. We contacted the surgeries first to give us the list of people that they find it hard to engage with, and they didn't have their annual health check in the last 12 months. So we contacted them, we gave them a call, and the first call, if they don't answer, we call them again. And the third call, we send them letter that we are going to have a home visit. And when we have a home visit, we go and we talk with them, explain to them what is annual health check and why it is important. And staff have done presentation in reasonable adjustment and accessible information, which was very useful, and many GPs and have attended and listened to it. And we are asking the surgeries as well to have reasonable adjustment alerts and to tell the reception and other people who are the first people to meet when the person comes for annual health check, to talk to them and make them as comfortable as possible, and to have a good experience before even starting their annual health check. And we have provided surgeries and patients with pre-health health check questionnaires, and we supported people who needed to complete it before they go to their GP surgeries, because it's very helpful, and it gives more time to the GP to talk with the patient rather than just filling up the pre-health questionnaire. It's very helpful. And also we talk to GPs and to nurses about health action plans to fill it if there is any follow-up, and to make sure that the person live with one with him. Next slide, please. And we have trained clinical staff and nurses, and gave advice to GP surgeries when we sent letters and told them about the training we are giving, and it was very helpful, and it helped them as well to know how to fill up the action plan and other things. And staff have done with learning disability registered, she have cleansed it to check. She checked if anyone need to be added to the learning disability registers or to be removed. As many people, they have been diagnosed that they have a learning disability when they were little, but now that one turned out to be learning difficulty. So staff have had surgeries to cleanse the learning disability registered. And also we have asked surgeries to nominate a learning disability champion, and to be sure that every single thing that educate, promote, and help people with learning disabilities is taken care of. And there is a meeting every third Thursday of the month that is called Learning Disability Team Leaders Meeting, where many people from all over Norfolk, they come. It was normally for learning disability champion and leaders, but it was very helpful that we have even GPs, nurses, everyone who are not, they are not learning disability champions. And we have contacted the learning disability communities team. We have been working with them for some time now. And also we visited, as I said before, community groups and traveler sites. Thank you. Next slide, please. My slides are finished now. I hand it over to Steph. Thank you, Steph.
Thank you, Leila. So I just wanted to illustrate some of that with a very quick case study about some of the work we did. So for the purposes of this story, the gentleman's name is Tom. That's a fake name, but just for the sake of the story. So Tom was 23, is a 23-year-old chap. He'd never had an annual health check, and he had been noted as did not attend on his medical record for at least 2 annual health checks previously, and he'd not been to the surgery for a good 2 to 3 years. So we went to visit him at his family home. He lived with his mum and siblings, talked to him about what the annual health check was, and explained why it was important, and he was agreeable to booking an annual health check. When it came to the actual day of the health check, so we supported him to book that, and once it sort of came to the day, he was feeling quite anxious about it and wanted some additional support, so we went along with him. When he went to the health check, it was he initially saw the healthcare assistant followed by a GP, and it was picked up in his urine that he had some sugars in his urine, which the GP was a bit concerned about, and did a sort of some further testing, and then a referral to the hospital because she was quite concerned about that. And we then supported him to go to the hospital the next day, and he was actually diagnosed as a type 1 diabetic. And as we know from what the others were talking about earlier, he wasn't aware, he hadn't felt any symptoms or recognised any symptoms. So it's really important that we're able to identify this through his annual health check, so he'd get the right treatment and things that he needed before he became quite unwell with it. So I just wanted to tell you about him, because that kind of shows some of the work that we've been doing and what we've had with quite a number of people. Next slide, please. What went well in our project? So at the end of the year, we did an evaluation report. So that's what I'm going to try to talk you through a little bit of now. So we know that more people had their annual health check in Norfolk and Waveney, and in particularly the Norwich area that we worked with this year than previous years. As I've just talked about, we were managed to find health needs earlier for patients and then able to support them with that. Leila talked about the Learning Disability Leads meeting, and I really want to stress that it's one of our successes really. We initially started it just for Norwich, and then we opened it with requests to more of Norfolk and Waveney. So I think we have over 60 of our surgeries in Norfolk and Waveney now in the meeting, with kind of requests to join all the time. And we're trying to make that kind of central point to share all of our information about learning disabilities. We've got I don't know for any of you that might use Microsoft Teams, there's also things called channels where you can put lots of information. So we're trying to use that as a central point to share everything, asking colleagues from various teams to come and talk to the GPs, practice nurses that come along. So I'm really pleased with how that's going. We also did some audits with the surgery. So some of you may be familiar, there's a tool about improving annual health checks from Public Health England, and we used that at the very start of our project and at the end to see if there would have been an improvement. Most of our surgeries started with a score of bronze. It was bronze, silver and gold. They started with a score of either bronze or nil, and the majority of them moved on to silver at least, and there were also some gold, so we were really pleased to see that throughout. Next slide, please. And obviously that means we saw that some of the individual practices that we worked with, we saw quite a lot of change in quality, which was really pleasing to see. And also we did our training program, as Leila mentioned, which again was really well received. And we also recorded that and made that available via our training hub as well, so that everyone could kind of have access to that. Next slide, please. So some of the challenges we had over our project, so obviously we started in March last year, so we had some difficulties due to the COVID-19 restrictions in seeing people and getting out, which obviously hindered our progress a little bit. We wanted to do more joint appointments than we did with surgeries to look at kind of supporting with quality, and that's something we're going to look at going forward in this year. We had some things to iron out in terms of gaining access to systems and sort of making sure that all our legal stuff around that was in place, and that sort of held up a little bit at the beginning of the project. And we offered it out to all surgeries, but it was their kind of choice whether to participate. So we had about 3 of our surgeries out of 21, I think, that didn't participate with us. Next slide, please. So from our kind of evaluation and looking at what we've done over the year, we found that there was 4 points really where we'd really kind of learned quite a lot of lessons. So I'm just going to go through each one with you. So next slide, please. So in the area of quality, as we've already talked about today quite a lot, there are differences still within the quality of the health checks that are provided across our GP surgeries. Also with recording reasonable adjustments, so we have done some sort of bespoke training on that for surgeries, and we're going to look at how we do that forward. I know there's a bigger project to look at that, but we're really trying to promote surgeries recording and utilising reasonable adjustments. We also want to make sure that all surgeries are using accessible invites. We're also really promoting that surgeries call patients to invite, because we found that that has a higher success rate. Next slide, please. We're also really encouraging surgeries to look at patients who are recorded as being declined for their health check. So we want to look at why that code is being used, if people fully understand what it is they're being invited to, why it's important, whether their capacity is being considered in that decision. So that's something we really want to work with surgeries on this year. Similarly to what Daniel was saying as well, we want to look at the kind of recording of ethnicity across our system to make sure that we're looking at, again, whether there's a a difference in attendance from people from other ethnic minorities. We want also to look at, again, similar to what Daniel was saying, the invitations from age 14. We noticed in our work that some people were getting to 16, 17, 18 and hadn't had their first invitation for their annual health check. So we've been working really closely with our children's colleagues around that. And also, as we talked about kind of throughout today, improving the health action plans and making sure people leave with a health action plan, and that surgery staff understand fully what a health action plan means. Next slide, please. So around education, we want to make sure that all the staff in the surgeries have access to training around the annual health check. Our colleagues on the call, I think Open Doors are here. They did some great peer training, peer-to-peer about annual health checks. So really would like to look at doing that again, and also involving that expert by experience in the training that we provide. And we also want to look at training for carers and families. So when we've engaged with some of our families from 14 to 18, they don't necessarily know about the annual health check and what it is, so we want to do some more kind of promotion around that. Next slide, please. So the learning disability registers, so every surgery holding a list of patients they have that are registered with a learning disability. So we have been supporting with cleansing on that, excuse me, and supporting surgeries to make sure that people are added to the registers when they need to be. We're working quite closely with our colleagues in Norfolk County Council to try and now look at beginning some work about sharing who they know and making sure that GPs also have that information. We want to support surgeries to use the correct codes that make sure that people then get onto the learning disability register. And there's also a mixed use in surgeries around learning disability and learning difficulty. And I know obviously people do identify themselves as one or the other, but in terms of kind of clinical coding as well, we need to make sure that the GPs have an understanding of that to make sure that people are on the registers when they need to be. Next slide, please. So we also want to look at our outreach and engagement. So as Layla said, we've been going out to people's homes and visiting them to talk about health checks, and we found that that really has a high success rate. And we've gone to some of our day centres and community hubs in the areas, and some of our colleagues have also gone out to the schools. So we really want to look at how we can kind of continue that going forward, as it's been really successful. And also review the easy read information we have, and also as part of Leia's project as well, looking at what's been discussed already, but looking at some of the easy read information we have in other languages as well and what's available. Next slide, please. So what next? So we kind of touched on some of the points throughout the presentation, but we are going to continue our current model, and what we've been doing to the project is going to continue for another year within the area of South Norfolk now. We're going to continue our Leeds meeting and put some time into planning that, making sure that we're getting feedback from GPs as well and practice nurses about what they would like to see in that meeting and making it useful for them. We'll continue working with our colleagues across kind of all of LD services. Next slide, please. We are at the very early and beginning stages of developing a working group for annual health checks, so we can bring together kind of everyone within the area who has an interest and look at how we can really start to make those changes in annual health checks. As I said, we're going to continue with our education and really promote that, make that available kind of online as well, so people can access it as and when they need to. And continue our outreach and promotion of annual health checks to people with learning disabilities, their families and carers. I think that's just next slide, please. Yeah, we did do some time for questions, but I'm not sure how much time we've got, but happy to take questions at any point.
Yeah, thank you, Steph and Layla. It has been a really interesting project, starting from having it based within a GP central PCM model, and the outcomes have been seen because more people are having them across the year as opposed to everyone having one after Christmas. So that's also been a real positive. I'm just going to quickly go through some of the questions that are in the chat. there was someone asking about they struggle if they are probably maybe social prescribing. I can't remember what the title was, but after you've had an annual health check and then go and get additional support, that they don't have enough information. It was a lady called Donna, and whether or not anyone's using pen portraits. I think that's a really interesting one, because I would really like to say that what people should be using is their action plan, and the action plan should be really comprehensive and full of detail in it. In addition to that, a lot of people also have, some places call them passports, some people have documentation about their details of what kind of reasonable adjustments they need, but also other places purple folders. So they're called different things, but I think there should be other information that people could bring to those meetings. The discussions around champions were very useful, and people have found that really helpful. Someone asked for a specific role of the champion. So what we'll do is take that back, and maybe we could just have some paragraphs, like I say, some frequently asked questions. And also how to engage with decline. So maybe we'll pull together some ideas and send that around with the lead. So when all our presentations come in, we can talk to everyone across the region and see what their views are. I know that, thank you very much, Steph. I'm very conscious of time, and it's 1:15 now. It says a comfort break. There's 81 participants on, and I would really want to see people stay on. Can I suggest, shall we maybe continue, and then if anyone in that time needs to get up and stretch their legs and listen in the background, then that would be helpful? Or is the consensus everyone really needs a break? Because I'm quite conscious I want to give 15 minutes to Cambridge and Peterborough, Hertfordshire and Suffolk. Would everyone be all right carrying on? And just maybe getting a bit of a jumping up if you need to. Yeah, I'm gonna take that. Yeah, it is well done to Steph. It has been a really interesting project. I don't think even your presentation with you and Layla reflects just how many the outcomes that's changed as a result of that. So thank you. I think I just want to maybe move on from the comfort break, and I'm sorry if people really need to go then for a break, then do take it. But I do think that I'd like to give everybody a chance to speak. So is Rebecca there? Is Rebecca on?
Hi, yeah.
Hi, Rebecca.
Hello.
So, sorry, I didn't give you a break.
That's all right.
And it's interesting because Cambridge and Peterborough weren't able to attend the initial one last year. So, but they have been working in the background, and this will be something you'll be able to hear about what impact the changes they've made. So I'm going to hand over to Rebecca. As I say, jump up if you need a stretch, but please stick with this because there's some other interesting projects to also talk about. Thanks.
Thank you. So my name is Rebecca Ford. I'm a community learning disability nurse working in Cambridgeshire. In particular, I work in East Cambridgeshire. Next slide, please. So I've been asked to talk about the kit bag project that we've had and training for our GPs in our area and how that has led to successful annual health checks. Next slide, please. So a little bit of background about us. So we work in the Learning Disability Partnership in Cambridgeshire and Peterborough, and we work with adults with a learning disability across the whole of Cambridgeshire. We've got locality teams in Fenland, Huntingdon, East, South and City. There's also a team in Peterborough as well. And each locality team has community nurses like myself who work as link nurses to the doctor's surgeries in that area. So we all have different surgeries that we link into. Next slide, please. As that part of that role as link nurses, we provide training to doctor surgeries about annual health checks, about what a learning disability is, and more importantly, what a learning disability isn't, common health conditions that people with learning disabilities might experience, particular syndromes, that kind of thing, just to raise awareness of learning disabilities, because although people with learning disabilities might be a very small percentage of the overall GP list, actually, when we look at the figures, people with learning disabilities often present more frequently at the GP surgery with a lot more complex needs. And so really, if we can train the GPs and the practice nurses and make them more aware of people's needs, then it helps the whole process and makes everyone's lives a bit easier. So the training is arranged through the GP hub, and anyone from the surgery can book the training. Next slide, please. So the training was not just with us learning disability nurses, but also what we put it into 2 sections. So the first section was delivered by our lead GP for the area. And that really helped give an emphasis to GPs about how important it is. And then the nurses did the second part of the training around the particular syndromes and health-related problems, why it's important to complete an annual health check. We looked at the figures of people with learning disabilities suffering from COVID and unfortunately passing away as a result of COVID, and the importance of making sure that people's general health is as good as it can be. We looked at sensory integration and the importance of that for people with learning disabilities, thinking about the environment of the surgery and if there's anything that can be done to make that as welcoming as possible for people, thinking about for some people, actually, they do need to have their annual health check done at home or in a neutral environment, and thinking about how that could be facilitated within surgeries, because obviously, you know, GP surgeries are very, very busy places, thinking about whether we could offer appointments at a later time in the day or a quieter time over lunchtime when there's not other patients around and lots of noise and distraction in waiting areas. We also focused on challenging behaviour and the reasons why some people experience behaviours that challenge and what that might mean, and viewing it very much as a way of communication rather than a problem, and trying to identify what people are trying to communicate, so that then they don't feel the need to have to experience challenging behaviours. Thinking very much around how people might be very anxious and stressed going to a GP's appointment. And we had some really useful sort of dialogue with GP surgeries around ways that they could make people feel more at ease, which was really good. We spoke a lot about reasonable adjustments, and actually by making a couple of very small changes can have such a massive success rate on people actually attending and successfully having their annual health check. We also offered a session on how to actually use the annual health check on the computer system, because we designed the actual check list. So on system 1, we would have someone who would be able to talk people through the important bits to complete and the buttons to press. And as you can tell, it wasn't me that did that training. Next slide bit, please. So we were also very lucky to secure some funding from the CCG to obtain kit bags for each of the locality teams. So in these kit bags, they have equipment that we would expect to be used during an annual health check. So for example, we've got to take your blood pressure, we've got things for blood tests, we've got stethoscopes, we've got lots of different equipment, and as you can see in the picture there, we've got the scales. And the idea behind this project was to think about how we could help people attend their annual health check without feeling so vulnerable and frightened. So we can take this equipment out to people in their own homes, maybe months or so before they're going to have their annual health check, and just get people used to the equipment so they can touch it, they can experiment with it, and they can really get to understand what it's going to do, how it's going to feel, without then becoming really frightened in the unfamiliar environment of the GP surgeries. Next slide, please. So yeah, so we can work with people with a learning disability to get them used to the equipment. And there's an example there in the picture of some of the equipment we've got. We've also got masks to get people used to wearing masks if they maybe require oxygen. We've got specters for people that are for ladies that are going to be having their cervical screening tests, so that people can get used to what is going to be happening. And we found that, you know, obviously if people have awareness and education about what's going to happen to them, they're a lot more compliant and feel a lot more comfortable in order to complete these tests that are needed. We have a lot of referrals for people that have needle phobias, and so we can work with them on a one-to-one basis just to get people used to and familiar with the procedures that are going to be needed to happen, and what the equipment will look like, what it feels like, where they might go. We might take people to the surgery before appointments just to walk them through the surgery so that they get used to it. Meet the receptionist, you know, see where they might sit, all of those kind of things, so it becomes a less daunting experience for everybody. Next slide, please. And that's me done. If anyone's got any questions, thank you very much.
My camera's just come on. Thank you, Rebecca. I know it was sprung on you quite last minute as well. But it's good to hear someone that's actually using the equipment and how important it is to help people. That would mean that their annual health check and the service and the support afterwards is going to make things easier for people and make those reasonable adjustments happen a lot easier. So I know that is quite a lot active in the chat. I do think the kit bags have really, by the sounds of things, made a difference, especially for your work, because you can really spend time with people to get that desensitization and all those concerns and worries out the way. Just looking at a few of the questions, I think there was one which has been answered by Steph around who can deliver an annual health check. Ultimately, anybody who has an annual health check, that GP is responsible. Whoever's delivered that annual health check, that GP is the responsible person. So I think it's really important that the GP is involved, but it can be anybody who is a practice nurse, someone, but they have to feel confident in the areas they're asking. So you wouldn't want maybe a healthcare assistant to ask you about your medication, because maybe they're not trained in those areas. So it's really important when you have your annual health check that the people that are asking you those questions, and there's a number of different parts of the annual health check, isn't there, that it's the right people. So it can be available in it. So, you know, it's quite often lots of places are now doing more than one person to help that happen.
I can just see there's one question about in Cambridgeshire, how do we make the GP surgery aware of the training? If you, I don't know what area of Cambridgeshire you live in, but if you contact your local learning disability team and make them aware, we have links with all the GP surgeries, so we could have a discussion with them if there are particular issues. Is that okay?
Yeah. Someone's put in around had a question about challenging behaviour, which they directed to me. Who was that?
That was me. That's a very important one to deal with, because a lot of, you know, how I see things, sometimes other people don't. When other people explain something to me, they explain it like from an email or something in the wrong contents, or like if someone say, why is this and why is Stephen doing that, and I'll feel like challenging them. And I think, you know, and there's a thing that Abby does, which is called a stop and stamp campaign. So when she stops, say stop there, and then she explains it to me. It's like, oh, you know, it's like a traffic light thing. She say stop, you don't need to challenge anybody. Oh, and you know, and she'll like, and then that's why she's done it to me there. She says, put it in the chat, stop, Don't say no more. So she does a very good job at putting her hand up in front of me, say stop. It's like before I react, sort of thing. So I can't say it in front of 74 people. So I'll have to explain it to Abby in person what I want to challenge about.
Yeah. That's brilliant, Stu. I think it's really important that we share some of those, and I think if anything, today's lesson about this session is, one, I know Opening Doors had to have a little bit of a break, that we need to incorporate a break, but also there's so much to talk about around annual health checks that actually, you know, maybe we haven't given it just enough time for those questions afterwards. But thank you, Rebecca.
That's okay. I would just say that because of the training that we've done, we've forged really good links with our GP surgeries. And so if there are issues, our surgeries are contacting us to say, you know, can you help with this situation? Or have you got any ideas, which is really, really good, and has helped, you know, a lot of people. So it's really good. Anyway, thank you very much.
And we're now making sure Cambridge and Peterborough tell us all these wonderful things, because they've been very quiet and all these things have been going on in the background. So you'll hear lots about Cambridge and Peterborough, because there's lots of other projects going on around things like dysphagia and around like the kit bags, which we really want to share. So thank you so much, Rebecca, for standing in and also then being able to articulate it in the right way and tell everybody about it, because I know you're doing it on a daily basis. And it's really important everyone hears what's going on across the region. So thank you. I think there's a lot of people asking things like, how do you get hold of your community learning disability nurses? I think I have to probably, yeah, if you could put for Cambridge and Peterborough, but if anybody else is on who's from a community learning disability nurses team, if anyone else can, if they say Cambridge and Peterborough details, because I think there's quite a lot of like email addresses that are just very central. If anybody else has got central email addresses, then if they could put them in the chat from the nursing side, and we can collate them at the end and send it out as part of the frequently asked questions. Thank you, Rebecca. I'm going to move on now to Hertfordshire, and we've got Hilary and Emily going to talk about their project. I use their, Hilary and Emily.
Hi there.
Thank you, Emily. Hi. And I'm sure Hilary's, I think she's in there, but yeah, I'll let you.
I'm leaving it all to Emily. I'm here in the background.
Oh, brilliant. Oh, that's nice. I mean, new face. Well done, Emily. Right, I'll pass you over to Emily then. Thank you.
Thank you. I'm just waiting for the slides there. Lovely. Thank you. Yeah, so morning, everyone. And thanks for the presentations so far as well. They've been really interesting. So thank you for that. So I'm going to be talking about our Learning Disability Care Coordinator pilot scheme, which is happening right across Hertfordshire in 2 separate CCGs. My role is Health Equalities Nurse for annual health checks, and Hilary, who you just heard there, is the Strategic Liaison Nurse for Primary Health, and we both work under the Health Liaison team within Hertfordshire. Next slide, please. So just to kind of give you a little bit of context about kind of what the issues were in terms of annual health checks and how surgeries were actually able to kind of manage them and also coordinate the patients who are on their learning disability register. So some of the kind of key issues that we found were that there were significant barriers for individuals attending their health appointments. And it will come as no surprise to anyone that GP surgeries are extremely busy places of work, and there are limitations in terms of how much a sort of reception or administration team can actually deal with. So what we found that a lot of the surgeries didn't know the individual patients who were on their learning disability register. It may be that they were kind of, they knew of a sort of proportion of them, but there were always those few who perhaps didn't quite get through that gap and perhaps slipped just through the net a little bit. So those hard to reach patients, and I know that's a kind of ongoing theme today, were kind of missed. And I think it's about really trying to identify kind of how we could overcome some of those issues. Clinicians as well themselves, GPs, may not have had time to actually investigate the individual needs of those patients. As we know, accessibility to the right kind of correspondence, so letters, documentation, all of those things, if they're not known about and the adjustments aren't there in the first place, it's very difficult to ensure that people on an individual basis are as engaged as possible. So surgeries didn't really have that kind of consistent designated person to actually help to bridge that gap and support those individuals who are on the learning disability register, perhaps really wanting to have contact with their GP surgery, but they're not able to as a result of that person just not being there. So that's kind of how the pilot scheme initially came about, was trying to identify who could actually facilitate the needs that are required for patients with learning disabilities. So we've got 2 separate care coordinators across the county. One is based in a primary care network within East and North Herts CCG, and another is in a primary care network within Herts Valley CCG. So there's 2 separate posts at the moment. One started back in December and the other started in March. So it's still relatively new project. Next slide, please. So previously, in terms of what we have tried with our GP surgeries across Hertfordshire, there's about 105. So it's a pretty large kind of area, and obviously a large sort of group of patients as well. So previously we offered training and support to the admin staff within surgeries. And whenever we delivered that kind of training, there was always this very sort of positive response from surgeries who were really quite engaged with the idea of improving these annual health checks. Quite often it was a case of really just a lack of awareness and a lack of knowledge of, firstly, what the annual health check is and what it's designed to do, and also the potential risks of not having a good annual health check process in place. And again, we're kind of constantly going back to those individuals who maybe don't attend their surgery appointments regularly, and the impact that might have down the line in terms of delayed diagnoses and preventable illness. So what we found was that within the receptionist team or the administrative team, there was never that ring-fenced member of staff, never that one individual who could actually follow up all of those kind of reasonable adjustments, all of the accessible information, all of the things that are so important in the world of learning disabilities and ensuring that people have equal access. So the pilot scheme as it stands at the moment is trying to identify the issues, you know, where previously maybe the surgery haven't been able to cope with the demands of coordinating patients and all of their various needs. And that's kind of what we're starting to improve on now. Next slide, please. So in terms of outcomes, obviously the fact that this pilot scheme is still, you know, pretty much in its infancy in terms of what we would like to do kind of long term, and if it was to be extended, we don't sort of have those hard numbers in terms of what we've been able to achieve in terms of increase, but we do know that there are generally an increase in uptake as a direct result of these 2 care coordinators actually taking on these posts. There's also an increase in the use of the preparation form. So in Hertfordshire, we've developed a new annual health check preparation form, which is a preliminary document, you know, in readiness for the actual face-to-face annual health check. We've revised our sort of existing version to a much more kind of easy read, more accessible format. And the feedback on that has actually been very positive. So we're really pleased that that seems to be making a difference. We would never want something like documentation to be the barrier as to why someone's not coming to their annual health check or indeed any health appointments. And also the increase in health action plans, you know, a common theme that really the annual health check isn't fully complete without that health action plan. So what the care coordinators have been able to do is actually ensure that patients have access to a health action plan in some form. So, chasing up with the GPs, checking on, the Ardens template, was a health action plan completed? And we've also developed a staying healthy at home checklist, which is a downloadable guide which links to all of our LD My Health guides. So things like know your pee, know your poo, know your wee guides. So all of those we're trying to kind of connect up and make sure that health is a 365-day task, and it's not just the role of the GP within a half an hour window to help support good health. It's actually something that should be going on collaboratively amongst everyone in that person's life to help support. So that's a real key part of the care coordinator role. And also identifying the need for social and welfare needs within that hard to reach patient group. So sometimes it's a case of, particularly if someone's not been seen for many years within a surgery, that the potential for kind of poor health and poor mental health as well, and potentially that whole person's life needs to be reassessed in terms of the type of social care provision they need. And in that way, the care coordinators know how to link up with our social care teams to ensure that actually if a social care assessment is required, then that's done. And actually just trying to assess what this person needs and how urgent that can be. We've also seen an increase in cancer screening uptake. So we have a cancer screening nurse within the health equality nursing team, and the care coordinators have been working directly with her to hand over their list of people who are due their cancer screening, and obviously identifying then the barriers as to why that's not happening across bowel, breast and cervical screening. An increase in STOMP uptake as well. STOMP is about stopping the over medication of people with learning disabilities, and it's very much in line with the quality improvement strategy from QOF. That's one of the sort of key areas of improvement that nationally we would like to see. So we have a STOMP team who actually work directly with GPs, work out who is eligible for a potential reduction in antipsychotic medication where there isn't a mental health diagnosis. And that really has been a very successful project. And again, it's about using that care coordinator as a bit of a link in order to actually achieve that. We know when we email GPs, typically we don't get immediate responses due to the nature of their kind of workload and their kind of back-to-back clinics, but actually having that coordinator means that the likes of Charlie, who's the STOMP nurse, Megan, who's the cancer screening nurse, there is that gap of how do we link the clinical side with actually the sort of direct support that we're trying to provide within the nursing team. And lastly as well, there's an increase in the identification of people with Down syndrome. So I'm sure, like most other community learning disability nursing teams, we actually offer dementia learning disability screening assessments to people with Down syndrome who turn 30 due to the kind of increased risk of early onset Alzheimer's. So that's something again that the learning disability care coordinator would run that check, see who might be eligible and double check to see, has this person actually had their dementia screening assessment or DLD? And actually then again, we're sort of trying to ensure that people aren't slipping through the net. Next slide, please. And just generally, in terms of kind of the wider scope for this role, and we can always talk about kind of numbers and increasing sort of data from that point of view, but actually the linking up and the collaborative working that's happened has been really, really exciting. So particularly within the East and North Herts care coordinator, they've actually managed to sort of link up really nicely with the social prescribers and the wellbeing coaches within the GP practice. So that's, you know, that's resulted in people being signed up for sports projects, things like the Shape Up programme, which is something that's run by Watford FC. There's all kinds of, you know, ways and means that the kind of community networking has been improved. You know, working out what services are available out there for people who might be struggling with isolation, loneliness, particularly in COVID times, and actually trying to prevent to promote health and well-being is a key part as well of the annual health check, certainly after the face-to-face consultations happened. There's also an increase in collaborative working with surgeries and community learning disability nursing in general. So, you know, understanding kind of what the specific needs are of individuals, particularly within that hard to reach group. You know, we've also had people who are, you know, there was an example of within the east side of the county, a lady who had never come to an annual health check, despite the fact she was 25. You know, that's potentially 9 years of things that may have been missed, or you know, missed opportunities potentially. And when the care coordinator actually called up the person's mum to say that this is what your daughter is eligible for, she couldn't thank her enough, because she had no idea that this was actually something her daughter could have. And you know, she said particularly since COVID, the family have felt very isolated and not really knowing what kind of support is out there. So the GP then became that missing link and became a little bit of a saviour for her, you know, in the sense that she now had somewhere to turn to if there were any health concerns. Naturally, we would expect our GPs to do that anyway, but actually having a specific designated person, first of all, in the form of a care coordinator, but also in the form of an annual health check that's just focused on that individual and what their needs are. There's also been, you know, and crucially, an increase in the reasonable adjustments and communication preferences. So we do send out a document to, well, on behalf of the kind of the surgeries. We've devised a form which is designed to allow patients to really fill in their individual reasonable adjustments and communication preferences. So it can be something, you know, very straightforward, like individual must have their teddy where they're having their flu jab, you know, something really simple like that. But actually that could make all the difference in terms of someone having that flu jab and not. So that's why flagging that information, making sure it's shared to all of the people who have access to that file, you know, it's such a basic solution, but actually it has a huge and sort of long-lasting impact, because those kinds of things, once they're recorded, they can only be added to and embellished in terms of getting it even better each year. So that care coordinator, knowing those patients, knowing what the reasonable adjustments are, flagging them on the system, that can kind of be the real difference that the role itself has made and hopefully continues to make. Next slide, please. So in terms of what we're doing next, so as I've mentioned, really the focus is on those hard to reach individuals. Within Hertfordshire, there's 105 surgeries, and that equates to just over 6,000 patients on the learning disability registers, and there's about 30 primary care networks within that. So we're dealing with generally quite a large, you know, large population of people with learning disabilities. And if we take, you know, if we assume that 75% of those people, or even 70% as the kind of East figure seems to kind of follow, you know, we've still got about 25% of those people remaining, and that would be that hard to reach list. So potentially over 1,500 people not really known about, not really understood. And, you know, hard to reach can mean a variety of things. It could be that the surgery don't have the right telephone number for them. It could be a really basic fix. It could also be a much more complex piece of work where you're looking at why someone might not be engaging. You know, are they anxious about the surgery? Are they, have they had a previous bad experience that's making them reluctant to come in? So that bit of investigation is what is really kind of crucial. And, you know, my role is also part of sort of working with the care coordinators and sort of seeing in a sort of collaborative way what's holding that person back and how can we support them. And then beyond that, in terms of the kind of wider impact of how the care coordinator role could support community nurses, it would also be about working out who are those people who are most in need. You know, we know that quite often if the need is not highlighted and it's not clear, then some people can very much go under the radar, and that's something we absolutely want to prevent. We want to ensure that all of those people within our learning disability registers are known about, and also all of their potential needs, any potential risks are identified. So the kind of nursing intervention then would be more targeted towards those most vulnerable, most at-risk individuals. Of course, you know, it's not a case of just separating those who we know a lot about and we see them all the time, but it's also about recognizing, hang on, there could be a problem with this group of individuals, and we need to make sure that they are supported effectively. That's it from me. Next slide, I think, is just questions. If anyone has any. Thank you.
Thank you, Emily. That is a really comprehensive breakdown, and it's again another example of a different way of looking at how we can do things differently. That kind of sounds funny, actually, a different way of doing things differently, but you know, another route where someone is the gatekeeper and someone who can be there just to direct people in the right directions and follow up things. It obviously is going to make a huge difference. So that sounds brilliant. So thank you. I am really conscious of time, so again, I'm sorry around no questions, because I'm sure people will really want to hear more about that because it is interesting. But I'm going to move to Alison. Now, just before Alison comes on, again, there's a lot of questions in the chat. I'm conscious that some people are having to leave, but please stick with it because Alison's done some interesting work, or her colleagues in East Anglia who want to share the work as well. So if we can just stick with it, and I'm quite conscious that people haven't been able to ask questions or get that break, but I promise you we'll, one, review that in future webinars, but two, also have a follow-up information sheet that we'll circulate. So I'm going to hand over to Alison. Alison, are you there? Thank you, Emily.
Yeah, hi Tracy, can you hear me?
Yeah, you're perfect.
Okay.
So
thank you.
Now.
Thanks. Morning everybody. My name is Alison Sadler, and I'm probably new to quite a lot of people on this call. From this Thursday, I'll be taking up my new role as the Learning Disability and Autism Transformation Programme Manager in the Suffolk CCGs. So I'm really new to this role, but I've been doing learning disabilities and autism with Wendy Scott for a couple of years, so not new to the LD&A world. A few of you may know that Sally Ryan was driving forward a lot of the work in Suffolk around improvements in annual health checks. And for those that don't know, Sally now has moved on and left the CCG a few months ago. So as I'm new to the role, I'm still really learning what I'll be doing and picking up. But what I'm going to try and do today is to just give you an idea of what we're doing in Suffolk to support the health and well-being of people with a learning disability. Could I have the next slide, please, Claudia? Thank you. So in Suffolk, we have the gold standard annual health check. And as you can see, we have 6 areas of key projects. These are all listed on the slide you can see, so I won't list them all out in detail. The next few slides that we will go through just gives you a kind of high level detail of each of these areas that you can see on this slide. And it's important to note that these areas, these projects do not stand alone, as they are all linked together and support each other, just like a jigsaw. So you can see the jigsaw pieces on the slides. Next slide, please. So I think it's important to say that the gold standard health check, we're obviously working with our practices and ACE Anglia to look at how we can keep these areas on the slide kept up to date and make sure they're in place. So things like the easy read invitation, work is going on at the moment around the pre-health check questionnaire, making sure it's up to date and everything is included that's important for people with learning disabilities. Making sure that practices have regular communications around what's available and accessible information, making sure they have easy access to these resources. And each practice within Suffolk has been asked to identify a learning disability lead to help with disseminating key information more easily and to have a key contact within each practice. Next slide, please. So the peer educator network, this is something that the Suffolk CCG's commissioned ACE Anglia, which started in 2018 to undertake peer education around annual health checks and the importance of having an annual health check. And people with lived experience are trained as peer educators to talk to people with learning disabilities. And it aims to increase the uptake of people getting an annual health check, getting more people onto the LD registers and empowering people to take more control of their own health. The programme has now been expanded for this year, so until the end of March next year, and includes also now people with learning disabilities from the age of 14 plus. So ACE Anglia are now going out to talk to colleges and special schools and engaging with those young people from 14 plus. Since the pandemic and everything moving online, ACE have facilitated some really interesting health and wellbeing online sessions for people with learning disabilities, and a plethora of health and care professionals have been invited to talk about specific topics such as mental health, screening, exercise, social prescribing, and have been really very well attended. And these will also continue for this year. Next slide, please. So as part of the long-term plan funding that's come down from government, it's really good that the primary liaison learning disability team will be able to be expanded, and work is underway to recruit a number of health facilitators to work as part of that team, and they will be able to support people to access health services, support with reasonable adjustments and desensitisation. A deep dive into the LD registers is to be undertaken, and NHS England funding will help to support the recruitment of a post to work with practices to develop a granular list, which will include when someone last had an annual health check, identify those who did not attend their annual health check, look at ethnicity data and the uptake of screening and flu vaccinations. And the primary liaison team will be able to help follow up some of these to explore and understand the person's story and provide necessary support to make sure that they get their annual health check and any other support they need after that. Next slide, please. So there is a pilot starting within Suffolk using funding from NHS England to develop learning disability friendly GP practices. A primary care network in West Suffolk and a practice in East Suffolk have shown interest in being involved. And this will include self-assessment tools, developing an improvement plan, people with lived experience being involved in the quality checking of those practices, training, and working towards the achievement of a quality kite mark award, similar to the dementia-friendly practices. Next slide, please. So screening and immunisation, obviously that will be picked up as part of the annual health check, and it will also be picked up as part of the deep dive to really understand who has had their screening and who has had their flu vaccines and COVID vaccines, and to pick up and work with those individuals who may not have had this screening and the vaccines, and work with them to understand and try and encourage them to have that done. Next slide, please. So the health action plans will obviously be picked up and reviewed and developed further as part of these projects, which will include awareness raising and improvement in the quality of those health action plans, and linking in with social prescribing. Next slide, please. So as I said just a minute ago, the social prescribing project, there's additional funding from NHS England has been provided to undertake a social prescribing project. And this will include training for social prescribing link workers, awareness raising, easier access to leisure activities. Next slide, please. So just to finish off, ACE Anglia have been commissioned to help support the delivery of the quality checking project and the social prescribing training. ACE Anglia are currently recruiting peer educators and a support post to help with the rollout of these projects. And we are aiming for the projects to start in July, following recruitment, induction and training. Next slide, please. And there's just some links to helpful resources that have been developed on the Suffolk Ordinary Lives website for anybody who's interested in having a look. I think that's me done, Tracy.
Oh, well, Alison, I have to say, thank you so much. I'm just going to try and get my camera off, given the fact you haven't even started your new job yet. And we're bombarding you with so much already. You can see all the work that was probably going on before Sally left, and now that gap. So we're desperate for Alison to pick up on all those exciting things that are going on ahead. And it's great to see ACE Anglia being supported by the CCGs to continue the good work of the peer educators, and not just continue it but expand it. And yeah. I think that's what we've seen over the course of the year, just all those bits of work that, particularly over the COVID period, about maintaining good health through the Zoom calls that they were delivering every week, and the impact that's made, because people know that they need to go for their annual health check. So thank you so much, Alison, and yeah, we look forward to you starting on Thursday, even though you've presented today. So thank you.
Thank you.
So we haven't really got any chance for questions. And I know that people are probably either eager to go off for some food and a break, because I never gave anyone a break, but also to go on to future meetings where they have to leave. I just want to take an opportunity to thank everybody who presented today. It really is interesting to hear all the different pieces of work and the impact that they are making for people with a learning disability. But likewise, in the chat, there are lots of questions. And I think what I'll be able to do is take back the information, reflect on that, and also ask our colleagues across the region, you know, what do they do to answer these questions? So then we'll be able to create a document to be able to send out. So I'm sorry if I haven't been able to answer everybody's questions. You can obviously see that there's lots of stuff happening, but if it's not happening to support you, if you're the person you care for, then I will put my email also on the document. So please come back to me, and if you've got any queries, we can take that forward. For now, we've just gone over, just also to thank Case Anglia for hosting it through Zoom and to be able to put it on their website after this. And thank you for coming. We will be running more webinars, so look out for those dates. And as I say, we'll get back to you with more information. So thank you for your attendance, and I hope it's been useful.